Hello and welcome to Aging is for Everyone. I'm Laura Mondello and I'm your host for the show. There are a lot of great healthcare options here in Western New York, and sometimes people don't know about what's available for them. One of those options is a program called Adult Day Healthcare. Here to tell us a little bit about what an Adult Day Healthcare program is and how it can help you, maybe your family, your loved ones, is Candice Duffy. Candice is the director of the Schofield Adult Day Healthcare program. Welcome to the program, Candice.
Thank you, Laura.
So Adult Day Healthcare is kind of a middle ground between somebody who might need like a nursing home type setting or some, but they want to stay at home.
Right.
And I understand that there's a couple different kinds of adult daycare. You know, and people might be familiar with adult daycare for children or daycare for children. Mm-hmm. What is adult daycare for adults?
Adult daycare is a comprehensive health and rehabilitative program. It's a day program, so it's for folks who live in their own homes but need the oversight of skilled health professionals to manage their health conditions.
Okay.
So we provide skilled nursing services, we provide personal care, we have rehabilitation, physical therapy, occupational therapy, speech therapy. We have a dietitian who provides nutritional oversight and counseling. So we're really, managing folks, mainly chronic illnesses and conditions such as diabetes, hypertension, things like that people have to live with, but can live, fairly healthy lives if their condition is managed.
Okay, so it's really a comprehensive program for people.
It really is, yeah.
Now I know there's a couple different, there are different kinds of daycare programs for adults, and I know that Schofield's is a medical daycare.
We're a medical model day program. There are also social model day programs out there, and those are wonderful programs that provide oversight for individuals, a structured day, structured activity, monitoring. They have activities, they have meals, they do some personal care, is my understanding. There's the medical aspect is not there.
Right.
The skilled services are not there. So it's really not for individuals who are, very ill, but just needs some structure and support during the day.
Right, right. And many times those are people who need that supervision because they may have a dementia.
They need supervision during the day.
Right. Now, who would benefit, say if somebody was to have some type of medical conditions, who would you say would benefit from maybe thinking about an adult day healthcare program?
Okay. These are individuals that maybe have had a hospital stay, maybe have been in a nursing home for a period of time, or just in a subacute unit from an acute illness or, accident or, hip surgery, knee surgery, things like that. So people that need a little bit more continued care after their acute stay or acute episode.
Okay, so somebody maybe who was in rehab and then instead of just going home,
right, they can continue their rehab in our program. Okay. We have a, really state-of-the-art rehab department with our physical therapists, occupational therapists, and we can continue that rehab at the program.
Right, right. As far as, Schofield's program, what makes that program unique?
We, number one, we're the largest program in the upstate New York region. We're really focusing in on, a coordinated care model, a managed care model. So we're working with other providers to really maintain, individuals with chronic illnesses so that we're, preventing hospitalizations, emergency room visits, repeated visits to doctor's offices. Because we do have oversight, and we're monitoring their blood pressure, their diabetes, different things like that. So we're keeping them, in a stable condition.
Right.
We also, manage their medications. So we're making sure they're taking their medications properly at the right time, right dosage. And the goal is to stabilize them medically so that, they're not getting into an acute phase where they do need to go to the hospital.
Right.
Or a more, costly level of care. So, we're really trying to be very cost effective in this day and age, and maintaining individuals, in a less costly setting and really where they want to be, which is in their own home.
Right, right.
So we can provide the care during the day, and they can go home in the evening and be in their own home and be with their family.
Right. I was just going to say this has to be very helpful for families.
It is.
How do you find, do you have stories about families who have been able to?
We're very close with the families. They're a very important part of the care plan. And individuals need to continue to work. So we're able to provide, that care during the day so they can either work or, just providing a respite for someone who may be getting burnt out from taking care of a loved one. And then they have the day to do their own activities and kind of rejuvenate themselves so that they can continue to provide, that loving care.
Right, right. And do you have any type of success stories, like a quick success story maybe you could share about? I'm sure you have a million.
I can't think of one success story, but we have been so successful in, helping people with their family members, either, getting out of a nursing home, being able to maintain, their ability to stay at home, keeping them out of hospitals, keeping their conditions maintained so that they're feeling healthier, they're feeling better about being able to move around and staying in their own home, and it's really good for, their overall well-being. So we have many success stories.
Right, right. And the age range for the program?
It's 18 and up, so we have some younger individuals that may have had a traumatic brain injury or maybe a multiple sclerosis, something like that that affects more, the younger folks, all the way up to, folks in their 90s who have chronic illnesses.
Right. So again, the age range kind of runs the gamut.
It really does.
For the program.
Yeah,
so
really
how can
does.
folks find out more about Schofield's program?
You can visit our website at www.schofieldcare.org or give us a call at 849-8720. We can set up a tour for you to come on in and look at the program. We'd be happy to give you information.
Great. Great. Well, thanks so much for being with us,
Thank
Candice.
you, Laura. Good to see you.
We'll be right back with more Aging is for Everyone.